On January 1st, a new Texas law took effect protecting patients from surprise medical bills. We're talking about the kinds of bills that hit people facing emergencies or in cases where they had no choice of providers. But the law does not protect all Texans. Steffi Lee looks at the limits of the state's surprise medical bill law and what policymakers say needs to happen next.
They were fed up because consumers are fed up and legislators were fed up.
Members, it's time for more protections in these types of situations where patients do not have a real choice or the ability to protect themselves from the bills they never knew were coming.
What legislators were fed up with were expensive surprise medical bills.
It can happen in situations where you don't get to pick your doctor. So an emergency, you can make sure you get to a hospital and you know it's in your network, but any doctor in that hospital might not be. When you get these bills with prices that are much higher than you would have paid in network, and you didn't know until after the fact that person was out of network, that's what we call surprise medical bills.
A new law going into effect starting January 1st protects patients with state-regulated health plans from getting these types of bills. It leaves billing negotiations between insurance plans and providers. There's also an exception when a patient specifically chooses an out-of-network doctor knowingly.
There's no patient who's ever going to be backed into a corner and asked to sign away their protections and pay more when they have no choice.
But experts say what happened in Texas needs to happen on the federal level for other health plans.
The good news is the lawmakers here in Austin have done everything they can to protect consumers. The bad news is the way the law works is they simply can't write laws that affect plans that are regulated at the federal level. And so we need Congress in Washington, D.C. to act to pass something that's similar to what we've done here.
Steffi Lee for State of Texas.
The new law only applies to roughly 16% of Texans with state-regulated health plans and people with coverage through state employee or teacher retirement systems. It does not apply to large employer-sponsored health plans or Medicare. Change there must happen in Washington, D.C. Texas Congressman Lloyd Doggett is trying to build support for a bipartisan solution, but he told us there are obstacles to overcome.
I believe the new state law will be a big help to many people. Beginning January 1st, no one is supposed to receive a surprise bill, that is one outside your insurance network that has shocked so many people. However, until we get federal action, there are about 9 million Texans who will have no protection. They work with companies that are self-insured. So we need federal action to complement what the state of Texas has done. My bill is targeted at all the people who are not covered here in Texas. And it's designed, again, to ensure the patient doesn't get trapped between an insurance company and a health care provider and get hit with a big bill. Sometimes these run into thousands, even tens of thousands of dollars, especially when you're taking a child to the emergency room or perhaps have elective surgery at the right hospital in your network, but they bring in people from outside that are out of network and hit you with thousands of dollars of bills. My bill will put a stop to that, and hopefully we can get some action in Congress. Unfortunately, in Washington, the same forces that have caught patients between providers and insurers are preventing our getting immediate action on this bill. The biggest hurdle are the powerful lobby groups in Washington who devote millions of dollars to advertising and significant contributions to the political campaigns of people in both political parties. I hope we can overcome that. The other big issue here is how much it costs the taxpayer. Because if we are allowing continuing escalation of medical prices well above the rate of inflation, ultimately taxpayers who pay for Medicare and Medicaid and other government programs will have to pay more, and all of us who have private insurance premiums will have to pay more. So I'm trying to assure reasonable charges, but not such excessive high charges that we drive up the cost of our taxes and our insurance premiums.
Congressman Doggett chairs the Health Subcommittee in the House. He told us the priorities on that committee include surprise billing and ways to address the high cost of prescription drugs.